How to complete the Essential Community Providers section. Issuers seeking to offer qualified health plans, or QHPs, including standalone dental plans, or SADPs, on the federally facilitated exchange must submit a completed QHP application per CMS guidelines. As part of the QHP certification process, issuers are asked to complete several application groups that comprise a complete QHP application in the Marketplace Plan Management System, or MPMS Module, within the Health Insurance Oversight System, or HIOS. These application groups are made up of sections containing issuer and plan-level data which issuers provide through uploaded templates and supporting documentation, or directly within the application's user interface. Among these groups is the Plan Attributes group, which is made up of 6 sections, including the Essential Community Providers section. In this section, issuers must demonstrate that they have a sufficient number and geographic distribution of Essential Community Providers, or ECPs, to ensure enrollees can access services without unreasonable delay. Issuers must submit provider data in each network associated with an issuer's plans. All issuers must submit ECP data through the user interface of the Essential Community Providers section of the Plan Attributes group, rather than submitting this data within a template. Please note that issuers must have linked plans and benefits, service area, and network ID templates prior to completing the Essential Community Providers section. For additional guidance on ECP requirements, including information on the general ECP and alternate ECP standards for issuers, reference the Essential Community Providers webpage of the QHP certification website. Now let's walk through how to complete the Essential Community Providers section of the Plan Attributes group within the MPMS module. To begin, navigate to the QHP Applications page within the MPMS module and select Edit from the Action column for the relevant application. This will take you to the Application Overview page. From the Application Overview page, navigate to the Plan Attributes group and select Edit for the Essential Community Providers section to proceed to the ECP Introduction and Setup page. On this page, indicate whether you are an alternate ECP standard issuer, which provides the majority of covered medical services through physicians employed by the issuer, or a single contracted medical group or integrated delivery system. General ECP standard issuers should select No. Your response to this question is final. You cannot change your answer after saving. If you are a returning issuer, you also have the option to indicate whether you would like to import ECPs from the previous plan year's application into this plan year's application. Returning issuers are strongly recommended to select Yes, I will select networks to import. Selecting Yes prompts you to select the networks that you would like to import ECP data for. Issuers that select No will not have any provider data from the prior year's application imported, and will instead need to select all the providers in the networks from a list of available ECPs for the state. Once you have confirmed your responses are accurate, click Save and Next at the bottom of the page. Please note that upon clicking Save and Next, the ECP Introduction and Setup page will lock, and you will not be able to edit your responses again. Selecting Save and Next will direct you to the Select ECPs tab to add and complete the ECP data associated with your application. Issuers that chose to import ECP data from the previous plan year's application will see the imported ECPs on this page. To add any applicable providers, click Add ECPs in order to search for and select available ECPs. Issuers are able to view each provider's ECP reference number, NPI, organization name, and site street address. To add a provider to your application, select the checkbox to the left of the ECP reference number. To deselect a provider, select the checkbox again. To add all available providers in the state, select the checkbox to the left of the ECP reference number column header. Available ECPs can be filtered using the View dropdown. For example, you may choose to only view providers by their ECP category, such as Indian healthcare providers. Issuers can also use the search bar to the right to further narrow their search by the provider's information. To add any new write-in ECPs, select the New Write-in ECPs checkbox. This will refresh the list to display available ECP write-ins in which you can select to add to your application. Once you have finished adding ECPs from the list of available ECPs, click Add ECPs at the bottom of the table. Alternate ECP standard issuers should use the Write an ECP button to submit providers in health professional shortage areas, or HPSAs, or low-income zip codes that the issuer directly employs or contracts with through a single medical group. Enter all required fields in the ECP details section before clicking Save. To remove a single provider, click Remove in the Status and Action column on the Select ECP page to remove only that ECP. To remove multiple ECPs, click the Remove ECPs button above the provider table and select the ECPs you wish to remove. You can also use the search bar to filter this list and remove ECPs tied to a specific network. Issuers should remove any providers imported from the prior plan years that are no longer under contract for the upcoming plan year. Continue to add all necessary ECPs to your application. For issuers that import the previous plan year's ECP data, review the providers you would like to retain or remove for the current plan year. You can review imported providers' associated negotiation status and network IDs from the provider table in the Select ECPs page to identify any needed updates. For each ECP that is added to an application, including ECPs imported from the previous plan year, issuers are required to provide additional provider contract details. The Status and Action column for each provider row shows a status of complete or incomplete. A status of incomplete indicates additional details need to be entered for the provider, while a status of complete indicates no further information is needed. To edit a provider's contract details, select Edit in the Status and Action column. For each ECP, issuers are required to provide the associated contract negotiation status and network IDs. First, select the applicable contract negotiation status. Contract executed if the issuer has already contracted with this provider for the upcoming plan year. Contract offer made, awaiting response, if the issuer has offered a contract to a provider for the upcoming plan year and is waiting for a response. Pre-contract negotiations in progress, contract offer not made yet, if the issuer and provider are still developing contract terms and conditions for the upcoming plan year. Offer rejected if the provider rejects the issuer's contract offer for the upcoming plan year. Contract not offered due to no response following issuer outreach, if the provider has not responded to repeated contract offers or attempts to offer a contract for the upcoming plan year. Facility closed if the provider is no longer in business. Facility does not contract and has no interest in contracting with commercial insurance, if the provider cites this reason for rejecting the contract. Note that this is distinct from a provider not wishing to contract with a particular issuer because of the offered contract's terms and conditions. Facility does not provide medical services, if the facility does not provide medical services. Facility does not provide dental services, if the facility does not provide dental services. Provider is in an exclusivity contract that prohibits issuer from contracting with provider, if the provider is prevented contractually from contracting with other issuers. Provider is not licensed, accredited, or certified by the state, if the provider fails to satisfy any of these requirements. Provider has relocated outside service area, preventing issuer from contracting with provider, if the provider has moved out of the issuer's declared service area. Please note that depending on the negotiation status you select, you may be required to provide the following additional data elements: the contract offer date, the name of the point of contact at the provider facility who provided the status of negotiations information, the point of contact's email address, the point of contact's phone number, and the information source through which you learned of the provider's changed status. Next, select the applicable network IDs associated with the ECP from the Network ID dropdown. Once you've confirmed all the provider contract details entered are correct, click Save. If you have provided all necessary information, the provider row will display a status of complete in the Status and Action column. Please note that issuers in states performing plan management functions and state-based exchanges on the federal platform, or SBEFPs, can update their network ID data in the MPMS module once their state transfers their network ID template. Additionally, issuers in states performing plan management functions and SBEFPs can download their ECP data by clicking Download ECPs and then upload this file as a supporting document into the System for Electronic Rates and Forms Filing, or SERF, to submit these data to their state. Once you have added all ECPs and provided the necessary provider contract details, select Save and Complete to save the Essential Community Providers section. Upon saving and completing this section, the MPMS module will run validations and display any validation errors or warnings, including any warnings for FFE issuers, including issuers in states performing plan management functions that are not meeting threshold or category per county requirements. Issuers also have the option to export ECP validation results by selecting Download. Review these validation results and make any needed updates to these data before selecting Save and Complete again to complete this section of your application. The Essential Community Providers section is one section within the Plan Attributes group. Please note that to submit ECP data to CMS, issuers must complete all sections of the Plan Attributes group and return to the Application Overview page to submit the completed application group for CMS review. If you have questions regarding how to navigate and use the HIOS MPMS module, please contact the Marketplace Service Desk at cms_feps@cms.hhs.gov or 855-CMS-1515. For more information about the QHP certification process, visit www.qhpcertification.cms.gov.